Hi, I'm Chesney Gary Martin and I'm a smoker. I know the risks. You don't need to lecture me on them. I started smoking to keep myself from cutting. I used to be one of those really screwed up teenagers that cut. I hated everyone and hated myself. I even got put in a mental institution because of it. But after I got out, I started hanging out with friends that smoked. They helped me a lot. Then I realized that if I smoked a couple cigarettes a day, I never had the desire to cut again. So I started keeping a pack of cigarettes on me. And then I started noticing the discrimination against smokers. Smoking has been banned in a lot of places such as restaurants, public parks, and beaches. Employers are refusing to hire smokers, and health insurance rates for smokers have skyrocketed. The worst thing to me, though, is the attitude non-smokers have towards those of us that smoke. Here's the deal. Smokers are people too, and the prejudice and discrimination against them has gone too far and has gotten way out of hand. Let's consider smoking to be like texting. You aren't required to stop texting or be in a designated area when you're outdoors. So why has smoking been banned and restricted in so many places? Do you enjoy that glass of wine or beer you have with your meal at your favorite restaurant? Well, I enjoy an after-meal cigarette. There used to be a designated smoking area in almost all restaurants where smokers could enjoy their meal and have a cigarette afterwards without bothering other people. Now we can't do that. Thomas Lambert from the Washington Post said that smoking bans address the negative externality smokers impose upon non-smokers and shape individual preferences against smoking, thereby reducing the incidences of smoking. Those are the arguments given for restaurant smoking bans. How do those arguments justify it? They want to ban smoking because of non-smokers' preferences against it? Well, I want to ban chocolate cake because I have negative preferences against obesity. But who am I to tell an overweight person they shouldn't indulge in that piece of cake? Nobody. Just like non-smokers are nobody to tell a smoker they shouldn't have that cigarette. We know the risks of smoking. It's a life choice. Not only can we not smoke in restaurants, we can't smoke at many public parks, sidewalks, or beaches. Believe it or not, most of us do our best to be courteous to the non-smokers around us. We understand you don't want to breathe our smoke, and you shouldn't have to. But we try not to blow it in your direction, not to exhale it when you're walking by, and we make it a point not to do it around your kids. You can't even smoke anywhere around hospitals. And I don't know about you, but the only people getting to go outside to smoke at hospitals are staff and visitors. And if you're visiting someone in the hospital, you probably need that stress-relieving cigarette. My grandmother was in a coma for a year after brain surgery, and I was up there every day, all day. I had to take a 45-minute trek because it was a mile to and a mile from the edge of the hospital grounds so I could smoke. Simon Chapman posted a journal on the tobacco control page regarding outdoor and hospital smoking bans. He states that outdoor smoking does not harm staff or patients. And because healthcare workers do not employ or somehow control their patients or visitors, there can be no justification on requiring them to not smoke outside. He says the health policy makers do not care about any evidence of harm, but are more concerned to impose standards of respect. Where's our respect? You can buy sodas and consume candy at hospitals, but you can't stand outside and smoke a cigarette whenever you're freaking out that your grandma is dying? Where's the justice in that? There's not any, but that's okay. We smokers understand and try to accommodate for the unjust discriminations. Smoking restrictions are inconvenient, but that should be punishment enough for smokers. Now, if you're a smoker, they're taking it out on you at work. Health insurance is a must-have. According to the article from the Urban Institute, uninsured people receive less medical care, less timely care, worse health outcomes, and a lack of insurance is a fiscal burden for them and their families. Face it, health insurance is something we all need. But what if you had to pay an extra 60% for your health insurance because you've drank sodas all your life? Well, sodas aren't that bad for you, you might say. But they contribute to obesity, and that's just as bad, if not worse, than smoking. You would be outraged if you had to be charged more for insurance because you were overweight. So why does it seem fine to charge more for smokers? An article from the Huffington Post said that health coverage for some companies are requiring smokers to pay an extra $720 a year for insurance if they hire them at all. That is outrageous. They don't make you pay more for insurance because you're overweight or because you drink a case of beer every night after work. Why is all of this getting thrown at smokers? Smoking is really one of the lesser evils in this country. Think about it. Smoking has almost always been limited on the job, but now they're limiting where you can work if you smoke. Ash.org's article on companies not hiring smokers says that the right of an employer to refuse to hire smokers is being exercised in an increasing number of states where local authorities and courts are recognizing that right. They also say that in most jurisdictions, refusal to hire smokers does not constitute unlawful discrimination. So what does? Would it be unlawful discrimination if you weren't hired at Walmart because you were obese? You would probably think so. So you can't smoke on your walk to work because you live in a restricted smoking area. You've either been refused employment or have been charged way more for insurance. Now you're at the bar smoking a cigarette and the man next to you starts bad-mouthing you, all because you have a habit. People can be really vicious towards smokers. Non-smokers frequently treat smokers like a second-class citizen, berating them with lectures on why they shouldn't smoke. Smokers don't berate non-smokers with lectures on why they shouldn't drink sodas. For example, I'll be standing next to the ashtray, smoking, at the UTPB campus, trying very hard to control smoke flow on a very windy day, when someone walking by me will turn and yell at me about smoking too close to them. I was standing still. He was the one that walked right next to me when there was plenty of free sidewalk space to not get anywhere near me or my smoke. I don't try to blow smoke in your face. I try to be conscious about my surroundings and courteous to others. But I need the same respect shown to me. I don't smoke in my house. I smoke in my backyard. I keep my cigarette butts in the ashtray, which then get emptied into the trash. But I have had someone visiting my house ask me not to smoke in my yard. Smokers are people too. We don't mean to offend anyone or cause anyone else to have health issues, but we would like to have the same treatment non-smokers do. In conclusion, smokers aren't treated with the same level of respect as non-smokers. They have been banned from smoking in designated restaurant areas, even in outdoor public areas. Smokers get charged a lot more for health insurance, and sometimes don't get hired at all. But the worst part about that is people have a really nasty attitude toward us smokers. Just remember, that paramedic that pulled your friend out of their car when they had that bad wreck and saved his life, he was a smoker. That nice guy behind you that pulled out a wad of cash from his pocket whenever you were at the register and couldn't pay because you didn't have enough money, he was a smoker. We're just like you. The discrimination has gone on for far too long. Thank you.